For most of us, taking medication means a couple of aspirin or an occasional antibiotic, a few pills, and a quick swallow of water to wash them down. But for countless people, a medication regimen is a complex mixture of pills taken at varying times during the day with various instructions. And many of these patients may also suffer from varying levels of cognitive impairment, which makes it very challenging to remember when and how to properly take medications. Medication non-adherence is a very complex problem that can occur for a variety of reasons. A patient may have drug interactions or take medications in the wrong combinations. They may take medications at the wrong time of the day or not adhere to the instructions on how to take their medicine. They may even be using medications that they should not be taking at all. Patients have several options available to help manage their medication regimen. They may start with a simple pill box, but as their regimen becomes more complex, they may need little reminders. As their medication regimen becomes more complex or their cognitive function declines, patients begin to need help from caregivers, either family or professional healthcare providers. Eventually, without that help, many patients end up in a hospital, nursing home, or hospice. But there is a way to postpone that final step. The Philips Medication Dispensing Service is designed to simplify complex medication regimens and provide both caregivers and patients peace of mind. Designed around a unique device, the Philips Medication Dispensing Service provides maximum flexibility and accommodates even very complex medication regimens. The medication dispenser holds up to 60 cups of medication, allowing for up to 6 doses a day. Depending on a patient's regimen, a fully loaded dispenser can provide anywhere from 1 to 40 days of medication and anything in between. Of course, the medication dispenser does more than just dispense pills. The Philips Medication Dispensing Service is a complete service designed to maximize adherence levels. It all begins by engaging caregivers from the start to ensure end users receive the help they need from someone they trust. A professional installer will guide the professional or family caregiver in organizing and loading medications into the dispenser, so caregivers know that medications are dispensed to patients or loved ones in the right combinations at the right time, even when no one is home to supervise. The Philips Medication Dispenser is monitored 24 hours a day to further help caregivers ensure end users adhere to their medication regimens. Following a missed dose, caregivers will receive an alert that the patient has not taken their medication. The Philips Lifeline support team will work to close the loop as well, reaching out personally when caregivers aren't available to help caregivers and end users make certain medications are taken correctly and at the right time. Here's how it works. When a Philips Medication Dispensing Service is ordered, a professional installer will schedule an appointment with the end user and their caregiver, usually a family member or visiting nurse. The installer will come to the patient's home to set the system up, including the setup of the dosing schedule and additional caregiver contact numbers for caregiver alerts as needed. The dispenser unit requires a solid flat surface and access to an electrical outlet and a phone jack, but will work with existing phone lines, so no additional lines are needed. To organize the patient's medications, Philips provides a loading tray capable of handling up to 6 doses a day. A caregiver simply lays out the dosage cups, adds the appropriate medications, and covers the cups, similar to what they might do with a simple pill box. To load the dispenser, the caregiver will unlock the front door, press the load key on the keypad, and follow the instructions given both on the display screen and in an audible prompt. The dispenser prompts you through the loading process for each day. When finished, simply press the OK key and close the door. The Philips Medication Dispensing Service is ready to dispense the right medicines at the right times after the caregiver leaves.
Time for your medication. Press button to dispense.
The Philips Medication Dispenser announces to patients when it's time for their medication. All they need to do is press a button and the dosing cup will drop. The patient simply picks up the cup, removes the cap, and takes their medication. To make sure the patient is notified of the scheduled dose, the voice prompts will continue every minute for up to 90 minutes until the button is pushed.
Time for your medication.
If the patient does not respond after 90 minutes, the dose will automatically be moved to a reserve bin inside the locked dispenser. At the same time, the caregiver will get a phone call alerting them of the missed dose. This allows them to step in and resolve the situation properly and ensures that the patient cannot overdose on missed doses. The device also allows for additional pre-recorded reminder messages such as,
"Take medicines with food."
These prompts offer patients an added reminder to help them maintain a successful medication regimen, especially when also taking non-solid medications such as insulin or eye drops. In addition to the regular scheduled dosing capabilities, the medication dispenser also offers 2 additional dispensing features. The first is an early dose capability. This feature allows patients who will be away during a scheduled dose to take their medication with them. The second feature is the PRN function. The PRN function is used for on-demand medications such as Coumadin. Once programmed into the system, on-demand medications are safely locked away in the dispenser. When the patient needs the medication, they can press the red button to receive a dose. To avoid accidental overdosing, PRN medications can only be accessed in the preset time intervals. So if a patient tries to get their PRNs too early, the dispenser will indicate it's too soon, come back later. The Philips Medication Dispensing Unit also features a rechargeable emergency battery backup system to ensure continued adherence. In addition, in the event of a power outage, an alert will be sent to the caregiver informing them that their patient or loved one is at home without electricity. Another important feature is the low dosage alert. 3 days before the dispenser runs out of medication, the caregiver is alerted to the situation. This minimizes any disruption to a patient's medication regimen. An online reporting feature provides caregivers with important information about the dispenser activity. Caregivers can log in at any time, day or night, and check for missed doses, dispenser functionality status, electricity status, and more. For seniors and other patients with complex drug regimens, the Philips Medication Dispenser is more than just a tool. It's a life-changing solution. With storage for up to 60 cups, flexible scheduling of doses including on-demand medications, an emergency battery backup system, and a comprehensive monitoring and voice alert system, the Philips Medication Dispensing Service offers patients and caregivers peace of mind. It simplifies complex regimens. It offers increased reliability and consistency for taking medications. It reduces the risk from errors and unnecessary complications. And it's proven to deliver 98.6% adherence levels for patients dispensing when prompted.